420 somewhere, and right now that somewhere is right here. So hello and welcome to the Cannabis Show. My name's producer Vince, and here's your host, Ricardo Baca.
Vince, thank you, dude. And to everybody joining us today, welcome to the Cannabist Show, where we talk about all things weed.
Hashtag all things weed.
That is the serious marijuana news and the fun stuff as well. In fact, if you pop onto the Cannabist right now, you could read stories about a Washington pot shop that's about to open its doors less than a mile from the Idaho border.
Not a whole lot of over-the-border violations there.
About a massive state and federal bust that arrested 14 Chinese nationals in connection with a 2,400 plant illegal marijuana grow right here in Colorado.
It's a productive illegal marijuana grow.
And about the National Fire Protection Association, which is steps closer to adding a chapter on marijuana grow and processing facilities to its fire code.
And Alicia Walls broke it all down for you on the Cannabist.
I know, check it out. Producer Vince, how you doing today, man?
It's sweater weather, Ricardo. I'm back in it. It's finally cold enough out at night, and I am thrilled about it, dude. I had a great time last week knocking out a bunch of social videos that our viewers are going to see all over our Facebooks and Twitters and Instagrams and not Snapchats, because we're not doing that yet. How are you, Ricardo?
I know. That was a good time hanging with you, man. It's all about spreading quality information, and yeah, it's a lot of fun. If you haven't yet followed us on Facebook or Twitter, Instagram, please find us, usually under Cannabist, usually a safe way of finding us. But hey, Vince, I think it's that time. Let's jump right into the Week in Weed, maybe?
I think we should dive right into the Week in Weed, brother. Let's do this thing.
All right, we are starting this Week in Weed in Oregon, where cannabis growers in the Rogue Valley are hoping to start up a tourism infrastructure that would mimic the state's vineyards and pear orchards.
But as we've talked about before, weed and tourism are a difficult meeting point for these 420 legal governments to manage, especially since marijuana is still federally illegal.
You know, what some of these pot farmers are seeing in this Oregon county speaks to the future of tourism in this space inevitably, and that is cattle farms being converted to grow marijuana crops, old barns being renovated with tourism in mind so they can host tastings, bed and breakfasts, and even weddings and other parties.
And Ricardo, as one Oregon pot consultant said, quote, "This is the old agriculture transitioning into the new."
Yeah, it's true, and I think, you know, it's taking its time, right? It's certainly taking its time here in Colorado. It's just taking a lot of figuring out, and for these government regulators to find a comfortable space in there. But elsewhere in the Week in Weed events, marijuana arrests in the U.S. fell to a nearly 2-decade low in 2015, and that's according to some very brand new FBI data.
And while some advocacy groups are already celebrating the numbers, the country's cannabis arrest rate still works out to more than one arrest every minute.
You know, here is the FBI's data, which shows that the total number of arrests for cannabis possession in 2015 was 574,641. That is the lowest number since 1996. It represents a 7% year-over-year drop and a roughly 25% drop from the peak of nearly 800,000 marijuana arrests in 2007 alone.
Legalization opponents point out that fewer than 1% of state inmates actually serve prison time for cannabis possession, but legalization proponents say that most people arrested for pot possession are held in jail for at least a day and still receive a criminal record that affects their current and their future employment.
You know, elsewhere in the Week in Weed, we look to travel guru Rick Steves, who is headed to Massachusetts to encourage voters there to say yes to the recreational marijuana initiative on November's ballot.
And while you might not recognize the name Rick Steves, here's a picture of him.
There he is.
Yeah, if you don't know his name, you know his face. He's the guy who has his own travel show on PBS and who writes his own travel guidebooks on European countries. He's kind of a nerdy older dude, but he lives in Washington State, sits on NORML's board of directors, and believes the U.S. war on drugs was a massive massive failure that unfairly targeted ethnic minorities.
You know, and that's a fact. The war on drugs did unfairly target blacks and Latinos, as the ACLU famously reported in 2013. But one of the reasons Steve's will make these 3 stops across Massachusetts is to hopefully redirect money from criminals into state coffers. To boot, Steve said he will donate up to $100,000 to the ballot initiative. And Vince,
Note.
I gotta tell you, dude.
What's up?
First up, I love traveling, as you know, and I use Rick Steves' books whenever I can. He is so good. I always prefer Lonely Planet if I can, but Rick Steves' books, he's just great. He has the best walking tours. Totally got my mom and I through Italy. I was very thankful for it. Plus, he has a really approachable voice. So.
Not bad for a quote-unquote nerdy older dude. But everybody, please do note, the initiative has some powerful opponents, including Boston Mayor Marty Walsh and Massachusetts Governor Charlie Baker. And the polls suggest the November vote will be a close one, despite what guidebook you're reading.
Sure, sure. Lastly, in the Weekend Weed, here is Cannabist policy and business writer Alicia Wallace with this week's quick hit.
For now, what happens in legal cannabis states has to stay in legal cannabis states. When it comes to touting the business of weed, the tourism offices in Colorado and other recreational cannabis states have been pretty tight-lipped. The reasons for that? Colorado's tourism chief, Kathy Ritter, recently told the Cannabist that 1, the feds still aren't too keen on legalization, 2, Colorado has strict marijuana advertising regulations, and 3, well, it's just not a major driver for travelers, she said. Other rec states and potential rec states like the Live and Let Live Nevada are taking wait-and-see approaches. The tourism brass in those states say they're open to the prospects of marijuana tourism. It just might take more dominoes to tumble. I'm Alicia Wallace with this week's Quick Hit.
Thanks, Alicia. Now it's time to bring out our first guest. He is Colorado's top-ranking doctor, and we have lots of questions for him. Making his first appearance on the show, it's my pleasure to welcome the Executive Director and Chief Medical Officer of the Colorado Department of Public Health and Environment, Dr. Larry Wolk, to the Cannabist Show. Hey! Pleasure to finally meet you.
Pleasure to meet you. Thanks for having me.
I know, after talking on the phone for all these years, it's always good to, you know, put a face with the name, but I think it's my single favorite thing about doing this show is just getting to meet industry regulators alike.
Well, thanks.
So,
thanks for having me.
Dr. Wolk.
Yes, sir.
Indica or sativa? I think a lot of people are curious where you are on the spectrum.
I don't know what those are.
Nice.
Yeah, I don't know.
Yeah?
Yeah.
Oh, you don't consume?
Well, I didn't say that. I'm just saying I don't know.
Oh, sure, sure.
Okay.
Okay.
Yeah.
I got that.
Yeah.
Now let's get into serious stuff, because some of the data points that you and your organization and many others are monitoring in these post-legalized days is teen pot use. Are Colorado teens using marijuana more or less in these post-legal days and these years after legal sales first started here? So what I am curious about with you is, you're the man. What do we know about teen pot use so far in Colorado, at least in the data that we have from the legal era?
Well, I think it's important to look at the data source, and we rely on something called the Healthy Kids Colorado Survey. And why we rely on that is that takes survey information from 17,000 teens across the state. And it's a validated survey instrument by the CDC and by the state health department. So you always have to be careful about which source of data you look at. So it's a very comprehensive data source for us, and using that data source, we see no significant increase in teen use since legalization.
And you and I have talked about the Healthy Kids Survey, as well as one that came from a federal agency, SAMHSA, that also found a similar context, right? That there wasn't any increase, any statistically significant increase, if I remember correctly, right?
It's correct. I mean, the one caveat, you know, both for adults and kids here in Colorado, is that of those who admit to using, you know, we have a pretty high prevalence of use to begin with. So prior to legalization, after legalization, no change amongst youth or adults for that matter.
And that was something fascinating that you taught me when we spoke on the phone last year. You did mention that it's nothing we're proud of, but it's just a fact that we have had high teen use pre-legal era, even going back a decade. So that's the case?
Yeah, relatively speaking. I mean, still 4 out of 5 teens do not use,
Sure.
But 1 out of 5 is still high, relatively high.
Yeah, okay.
Yeah.
Some anti-legalization groups, I think the last time we reported on the Healthy Kids Colorado survey, one of them released a press release specifically discounting our reporting because some of these anti-legalization groups are saying that teen cannabis use is up in Colorado. So, I mean, you're the one who runs the Department of Health, and so I'm just wondering what's going on here. What do you think is going on here? Is it just the manipulation of data that we see from time to time around these very hot-button issues?
I think so. Again, I think you have to consider the data source, and then, you have to make your own decision or opinion based on that. And so there are other sources of data, some of which show a potential increase, but the one data source that I've seen, sampled only 300 kids and only in particular parts of the state, not near as comprehensive as sampling 17,000 from the majority of the state.
Not so much, right?
Yeah,
300 to 17,000?
Yeah.
Oh, okay.
Yeah.
Well, I appreciate you sharing that because I think it's just something that we go through as journalists. We just want to get the story right, and we want to make sure that we're putting the right information out there. And I know me and my colleagues just kind of took it as a hit when this organization came out and said, well, I wouldn't believe what you read there, but teen use is flat in Colorado. How long do you think it's going to be before we really know the impact on our youth, our communities? I know in the past we've talked, and various state officials have said maybe it's a decade, maybe it's 15 years. Do you have any idea?
I mean, it really will take between 5 to 10 years to see an established trend. What we can say is we haven't seen an acute spike. The governor was so concerned, he had us do sort of a peek behind the curtain after the first year. It wasn't statistically valid, but it was just a way to kind of sample some of the schools and many of the teens across the state just to make sure that we weren't seeing a dramatic increase. And the good news is, even then, we weren't seeing a dramatic increase. And so at least in the short term, we don't see a dramatic increase and hope that that will continue.
Oh, sure. Okay.
Yeah.
I want to talk to you about an issue I know is important to you, and this happened last week, that a panel of Colorado lawmakers voted 5-0 to endorse the addition of PTSD to the state's medical marijuana law. This has no legal effect, but it is a recommendation to the full legislature when the session resumes. But what are your thoughts about this recent issue? We've talked about PTSD and MMJ patients before, you and I.
Yeah, I mean, I think, I'm on the record as having supported adding PTSD to the list of qualifying conditions, but the Board of Health took a technical approach to that in the past, saying, well, we just don't have the evidence through medical research to say that marijuana can be beneficial as a medicine for patients with PTSD. So my reasons are a little bit different. It's not necessarily an endorsement from my standpoint that medical marijuana is proven to be effective for PTSD. It's kind of a reality check. We know a lot of people with PTSD who are suffering from PTSD are gaining access to medical marijuana through other diagnoses. So I just assume, kind of get that out of the way and have people be honest about the diagnoses for which they're getting medical marijuana. And then the second is, through the medical program, at least you have the opportunity to work with a physician rather than potentially self-medicate or self-treat. And so I thought that by having it as a qualifying condition, it would allow more patients with PTSD who are using or seeking to use medical marijuana the opportunity to work with a professional, a physician, somebody in the mental health field, rather than just, again, seeking it recreationally and trying to self-medicate.
Sure. And it brings up such an interesting part of this whole medical conversation. As a physician, I'd love to hear your feedback on it. But, right now you do have so many situations with medical cannabis where it's like there is anecdotal evidence over here. There are people saying that it works for them. And in the meanwhile, there's no scientific backing. There's no triple-blind research, legit top gold star research done in the field. So how do you, as a physician, but also as a public servant, kind of navigate that that strange battle in your own mind, because here you are coming out saying, yeah, maybe we should give these PTSD patients access, even though there's no science saying that this does help them.
Yeah, I mean, I think legalization has changed the context, so we know that it's available whether or not a physician makes a recommendation or not. I also think that we have to sort of operate under this do no harm kind of paradigm or model. So it's similar to obtaining something over the counter or through a naturopath or a homeopath. You know, patients will often come to me as a pediatrician and ask about things, you know, for their kids. And so the first thing, you know, if there's no research, then you have to sort of look at, well, is it going to be harmful to this particular person to try this? And I think there are circumstances where it probably wouldn't be harmful for somebody to try a trial and see if it can be beneficial. Does that mean that there's an established medicinal value for marijuana in that circumstance? Not necessarily, but maybe there is a health benefit, and nobody would argue, myself included, that many people derive a health benefit from marijuana and many other substances, plants, things that, you know, don't require prescriptions or don't have sort of, you know, a singular form for which it's available.
Oh, sure. Yeah. You know, I am infinitely fascinated by this time in which we live. And we're going to talk some more with you here in a few minutes about, you know, the historical impact of what we're living through. But that'll just be a few minutes. In the meantime, thank you, Dr. Wolk, for joining us. Yeah, very much appreciate it. Yeah. Now, I want to throw to our very own Sir of Sativa, Professor Pat, for this week's entry in the new Cannabist lexicon.
Eighth of an ounce of cannabis weighed out to 3.5 grams. This is perhaps the most common unit of measurement for cannabis in the United States, but the rest of the world sticks with grams and kilos. For example, quote, I don't want a whole ounce of one strain. I like to go to the dispensary and get 8/8 instead, so I can try everything.
Thanks for that, Professor Pat. Always enlightening. Now, our next guest is also making his first appearance on the show, and he's also a senior state official here in Colorado, paying close attention to our cannabis experiment. So please help me in welcoming the Senior Director of Enforcement at the Colorado Department of Revenue, Ron Kammerzell, to the Cannabist Show. Ron, how's it going?
Colorado, great to see you.
Hey, nice to see you too.
Pleasure to be here.
I apologize. I should have asked ahead of time. Did I pronounce your last name correct?
You did, actually.
Kammerzell.
Kammerzell.
Oh,
yes.
cool.
Yes.
Excellent.
Yeah.
Where's that name from?
It's German.
Oh, okay,
German,
cool.
yeah.
Excellent. So, Ron, indica or sativa, where are you at?
So I enjoy Colorado craft beer.
Oh, yes, absolutely.
Yeah.
You know, we're lucky that we have access to Colorado craft beer. We had a visiting reporter from Germany in the newsroom for about 2 months, and he did a great piece a couple weeks ago just talking about how most Germans fancy themselves experts of a sort on beer, since this is kind of the motherland for brews, and he just was so amazed and impressed with the scene here, and overall realized that he didn't know anything about beer compared to even your average employee at the Great Divide tap room or something.
Right,
so
right.
He just kept telling us, you guys are so lucky to live here and to have access to this. So it's kind of a special thing.
It really is special. One of the states with the really most burgeoning craft beer industry. I mean, Oregon's up there, of course, and a couple of others, but we're right up there at the top.
Absolutely, yeah. Top 2, top 3, right?
Yes.
Yeah, that's what I keep reading. Ron, let's talk about October 1st.
Sure.
I know the industry is very much anticipating this day. I don't know that the public really knows what's about to happen, but big changes are coming into play here in the state's marijuana shops. So can you tell us some of the things customers might notice as this changeover starts to take effect, and what the dates are?
Sure. So the biggest step is that we've identified a new universal symbol for marijuana, and it is a red diamond with an exclamation point in the middle, and it also includes the letters THC. On the medical side, it also includes an M to denote that it's medical marijuana. Sure. That was the first important step in this process, to really try to really enhance public safety, public health, and more importantly, to allow consumers and non-consumers alike to be able to identify edible products that contain marijuana, whether it's in the package or outside the package. So all of our manufacturers that are licensed to produce marijuana-infused edibles, beginning on October 1st, will be required to manufacture them with that symbol actually printed, stamped, or marked on the actual product itself. It will also be required to be on the label, along with wording that says, this contains marijuana, and please keep it out of the reach of children. But the most important thing, and really it's a result of House Bill 1366, which was passed back in 2014, is the legislature, and I think all of us have an interest in what happens when that package gets torn open and something gets laid on a table. We want the opportunity for someone to look at that, recognize that universal symbol, and say, this contains marijuana. And so it really gives that ability for people to identify marijuana-infused products.
And that's a valid concern, because
Yeah.
I mean, I think a lot of people who aren't in the state, and we have a lot of viewers, listeners, readers who are not in Colorado, they're not quite fully aware that, right now, if you go to a shop, maybe you open up that package of gummies, and outside of the package, those gummies, the crackers, the chocolate bar, are not marked in any particular or uniform way.
Right.
And I was just talking the other day with some friends about this, and my friends aren't in the industry, but they said, you know what, I'm glad that they're doing that. Even as an adult who has no children, it's just a good reminder to me that when I consume that, there is weed in that.
Absolutely, absolutely, and we think it's going to be also important for school resource officers and administrators at schools to be able to know, if a student's consuming marijuana on the campus, that it gives them another tool to identify that and stop it from happening. Because right now, the feedback we receive from a lot of school administrators and law enforcement that deal with youth in our educational facilities is that they don't know. I mean, they could have a sucker or they could have a cookie, and they just don't know any better. And at least this gives another tool to them to be identifying that kind of behavior.
And so October 1st, they have to manufacture these.
Correct.
When do the old versions of edibles expire? Is that also October 1st, or is that later on in the year?
So beginning December 1st, retail stores and medical marijuana centers can no longer sell products unless they have the universal symbol marked on them. Now there's one exception to that, actually two exceptions. During this current legislative session that ended in May, the legislature carved out an exception for liquids. So what they said is the universal symbol has to be on the label. They can have a liquid up to 100 milligrams, but it has to have a container that's child resistant, and the measuring device has to be part of that container. So that exception was granted by the legislature during this session. The other thing is bulk products. So think of things like granola or powders. There's no way to really mark that universal symbol on them. So those have to be manufactured in 10 milligram individual servings, and it has to be in a child-resistant package.
Oh, sure. Okay. And all that goes into effect on December 1st.
Right. So the consumer in the store will, the reality is a lot of our manufacturers, because we passed this rule last November, a lot of them are already doing it, and they've been responsible and they've been proactive with it. So you'll already see a lot of products in the stores that, the chocolates and some of the other confections where they're already putting that universal symbol on it and have been for some time.
Sure, okay. Let's switch gears a little bit. I want to talk about underage compliance. Last time one of your colleagues, Louis Koski, was in here on the show, we talked about this, and I kind of want an update because, this is an interesting part of this economy. We've always had underage compliance checks at liquor stores in the state, and now it absolutely makes sense that these cannabis shops should be held to a similar standard, should be tested regularly by the state. So, what are you finding in these tests where you're going out? I guess they could be called stings. What are you finding? Are the shops getting it right? Are they not? Are they checking IDs, or are they letting some slip through?
So what's really interesting is we modeled this program. I'm also over the Liquor Enforcement Division, and we modeled this program for marijuana exactly how we do it for liquor. So
Sure, makes
we
sense.
send underage operatives into the store, see if they can purchase. What is interesting is it's very similar compliance rates that we're seeing for marijuana compared to the liquor industry, usually around 90%, 92%. And from time to time we can see that dip a little bit, and that's when we try to take some proactive measures with the industry and communicate out to them, remind them of the importance of this. And of course, a failed test results in the individual, the bud tender that served the minor, gets a criminal summons. They oftentimes get their license suspended. And often
their marijuana license
yes,
suspended.
Yes,
Sure.
their support license suspended. And oftentimes the stores have very little tolerance, as they should, for this kind of behavior, and they oftentimes lose their job as a result of it.
Sure.
And that's very similar to what happens on the liquor side as well. One thing that's unique for the marijuana industry is we license all the employees that work in the industry, including the bud tenders and the people that serve.
Sure.
Not so in the liquor industry. So the only avenue we have in the liquor industry is to write a criminal summons. On this side, these people have a lot more at stake. They're losing their livelihood if they lose that license. So we hope that that's an incentive for them to comply. And generally, for the most part, the licensees do a good job. But everybody, every once in a while, has some challenges there. And
Sure.
I think part of it is getting the responsible vendor programs to really focus on this, which they're starting to do, much like the liquor industry does. So it's kind of an evolution, but what's interesting is very similar compliance rates in the marijuana industry as compared to liquor.
That is.
Yeah.
And is there? You mentioned that there's a criminal summons for the employee
Yes.
to blame. What about for the business? Is there any sort of enforcement action or measure taken against the business?
There is, and so we also focus on the business. So they typically will get some kind of an administrative violation, could result in a fine, could result, if it's a repeat offense, it could result in a closure of the licensed business for a period of time, or additional fines and sanctions against the business. So it's something that we take really, really seriously, because it's really one of our primary objectives is keep this out of the hands of kids. Well, if the kids are going in the store and they're buying it underage, then that's a real problem. So,
right.
But a lot of it too is reaching out and doing education with the industry and doing, our whole goal is voluntary compliance. And I think this industry has been very, responsible in that regard. A lot of them are engaged in the responsible vendor training that's available, and they know the seriousness of this.
Oh, sure. Okay. I'm curious if you've been paying much attention to what's happening in California lately. Obviously, the governor passed medical regulation here in the last year at some point, and now they're voting on Prop 64 in November. Multiple newspaper polls are saying this is going to pass. Recreational is in their future. Given that you've been observing, you've had this observation standpoint on what we've been going through and
Sure.
such an integral role, I'm curious if you think there will be one or two interesting enforcement challenges that California will be facing here in the months and years to come, and what those challenges would be.
Yeah, I think it is fascinating. Well, I think the biggest challenge for them is just the scope of, it's one of our largest states, most populous states, geographically a huge area to deal with. So I think that's the number one challenge. I think the other thing is we have a lot of operating businesses there right now, and not totally dissimilar to what we had here when we transitioned into regulating the medical marijuana side in 2010. We had a lot of operating businesses, and then we had to license them.
Sure.
And that always presents challenges. But I think the biggest thing too for them is they have a kind of a patchwork right now of regulation. Most of it's at the local level. There's really no statewide guidance, or very little statewide guidance, and so trying to get all these local jurisdictions to conform to an overlapping statewide umbrella or statewide model is going to be a challenge.
Yeah, I can't even imagine, especially because the medical regulations aren't set to take place until
2018.
2018.
Yeah. So it's going to be an interesting journey for them to take, and we've had some conversations with the folks with the Board of Equalization and some of the other groups out there that are interested in how do we get our hands around the regulatory piece of this. And I think, but far and away, it's the scope for them that's going to be the biggest challenge.
Sure. I know some of my colleagues have spoken with Lori Ajax, who, the director of the marijuana program out there. She has a very big challenge on her hands.
She does indeed, yes.
I want to bring Dr. Wolk back into the conversation. Again, thank you to you both for being here. It means a lot to me to be able to have this conversation with you guys. But given what we know now, I'm curious how each of you think legalization is going in each of your realms of focus. Larry, starting with you, how is legalization going from this perspective of public health that you're charged with?
So, I mean, I think, like I said before, we're not seeing any significant spikes or issues or areas of concern, at least in the short term. And so one of the things that I always tell people is a benefit of legalization is the taxation. I'm sure folks who use don't necessarily like to have to pay extra in the way of taxes since the products are now legalized, but they help pay for a lot of programs and pay for a lot of, I think, the necessary education programs, surveillance programs, regulatory programs that allow us to learn as we go along and to monitor. And so as such, that's what allows us to say, we're not seeing this increase in youth use. We're seeing an increase in emergency room diagnoses with marijuana involved or hospitalizations, but a lot of that is being fueled by out-of-staters, and we're seeing actually a leveling off of that. And so that tax revenue allows us to, be involved in helping do that kind of surveillance and look to see if there are any public health impacts. So I would say by and large it's going okay.
I want to take this opportunity to congratulate you on Good to Know. What a smart education campaign, very successful, especially compared to a lot of other things that have been tried here and elsewhere.
Yeah, well, thank you for that. And I think we learned a lesson there. For better or worse, we started with a campaign that had the large lab rat cages on the streets that were a little bit too close to making it look like we were still criminalizing or a symbol of criminalization there. And for us to educate folks, we really had to engage the folks who are the likely users, and we had to take a much different approach. Same thing with youth. Our youth campaign is really targeted toward not a doctor telling a kid why this might be bad for your brain, but how marijuana might at early ages get in the way of what's next, and so waiting for the right age and the right time allows you then the opportunity to do the things that you want to do while you're young, and these things can wait until you're older. So again, we've learned a lot because we've listened to people who are advocates and really both sides to say how can we both best engage folks.
Sure. Good to Know, winner of a 2015 Cannabist Award. And I notice now Good to Know is helping you all spread the word of the new universal symbol on edibles. But Ron, let's move along. How is this going? Now we have almost 3 years of recreational sales history, almost 4 years of recreational history. How is this going from your perspective of enforcement, compliance, and everything else that you're overseeing?
I think we feel really good about where we are today. I think the challenge is keeping up with the legislative changes and regulatory changes that come about, and that's normal for a new industry. I've done that through the gaming industry in Colorado, and we'll reach a point where we stabilize. But there's a lot of tinkering that goes on in the first couple of years to make sure that we get the model right. But I think overall, in large part, it's been a great success. And I think a lot of it starts with leadership from the governor's office and from the General Assembly. The governor's office recognized very early on that it's not just about the Department of Revenue regulating this, CDPHE, the Health Department, the Department of Agriculture. And so Andrew Friedman, who is the marijuana policy coordinator for the governor's office, plays a really critical role in making sure that we're working in tandem with all of the executive branch departments. And I got to tell you, Larry's group, the Department of Public Health and Environment, is a tremendous partner with us. And we couldn't do our job effectively without Larry's help and his folks when it comes to testing and food safety and the Good to Know campaign, getting the word out on the universal symbol.
Pesticides, you guys have been working together on?
Absolutely. So, and the same thing with agriculture and some of the other departments. So I think it's a lot of it's at that policy level, making the right decisions. And I think the other thing that was really important is making sure that marijuana pays its own way. And so all that tax revenue goes into a marijuana tax cash fund and can be appropriated to address some of the costs of marijuana regulation and marijuana legalization in the state. So I think, you know, a lot of people made a lot of really well-founded good decisions in the beginning that have really set us up for a great deal of success.
And that's a good point. We mentioned Good to Know. That was paid entirely by marijuana taxes, is that correct? The Good to Know campaign, the creation of the campaign, as well as the expenses of advertising and marketing. So just in case some of our readers or viewers aren't paying as close attention to the Colorado model as we are.
Right, sure.
Well, gentlemen, it is time for the pot quiz. This is how we close every show. Just a quick test on cannabis current events, things happening here and elsewhere. So how this works, Larry, we're going to start with you. And if you get the answer wrong, you can steal the point and vice versa. So if you're ready, Dr. Wolk.
Competitive.
I'm a competitive person, so I'm going to really work hard on this. Go ahead.
All right. Dr. Wolk. Colorado's third largest city has one more license to give for a marijuana shop, and it's accepting applications until November 30th. Name that city.
What does it start with?
Can't tell you that.
Colorado Springs.
No.
Oh, it was hopeful.
For the steal?
Aurora.
Aurora, that is the right answer. Ron with the steal. Okay. Ron, your question.
Okay.
What talk show host / medical marijuana patient recently announced his new MMJ company called Linative Labs? Talk show host / marijuana patient, medical marijuana patient.
Montel Williams.
Well done. That is a second point.
I sent that to him. I was thinking that.
Oh man, you got to shut down those brainwaves, Dr. Wolf. Dr. Wolf, back to you.
Yeah.
Running back Treyas Jarrells left what Colorado University after playing all but one football game while high and quitting the team in fear he'd fail a drug test and lose his financial aid? So what Colorado University did he just quit the football team at?
Well, it must be the University of Colorado.
No. Oh. For the steal, Ron.
CSU Pueblo?
CSU is right.
He said Pueblo. He said Pueblo.
I know. I think it's
CSU.
Fort Collins.
Is it Fort Collins? Okay.
Yeah, it's Fort Collins. No points. And obviously, we really care about points here.
We
so.
do.
Right.
We do.
But, Ron, last question of the quiz.
Okay.
Is this worth 5 points?
This is, sure, whatever.
Why not?
You're the doctor. You make some of the rules. So, name the Colorado-based cannabis-centric social media company that has cut 40% of its workforce and recently defaulted on debt payments.
So easy.
So easy.
Shut down that brainwave, Dr. Wolk.
I'm stumped. I don't know.
Okay.
Really?
Dr. Wolk, for the steal.
I thought, can you repeat the question?
Yeah. Yes, I can.
I thought it was like the Department of Revenue thing. You should know this.
I should.
Go ahead,
The
give it to me.
Colorado-based cannabis-centric social media company They just cut 40% of their staff and recently defaulted on debt payments.
Snapple Chat.
Snapple Chat? What's Snapple Chat?
It's $1 million idea right there.
We're combining Snapple, the drink, with Snapchat. It is Mass Roots.
Mass Roots, okay.
Mass Roots, Denver-based company. I think that news just broke this morning, so
yeah.
Sorry to bust some very fresh stuff. You guys, thank you so much for joining us.
Our pleasure.
Excellent conversation. Thanks to my guests, Dr. Larry Wolk and Ron Kammerzell. Kammerzell, geez. But most importantly, thanks to you guys for watching and listening. I'm Ricardo Baca, joined by producers Vince and Don and the rest of the crew. Have a great day, everyone. We will see you next week.
I'm allowed to lose, I choose to win. I'm all in, I'm calling any posse you'll be raising at the end. I'll say it again, ain't afraid to get in. I'll be going for the jackpot with ace in my hand, I'm raw.